Welcome to Voices of Care, the podcast series from Newcross Healthcare, which aims to go to the very heart of the issues facing the health and social care sector. We're aiming to meet the challenge of the questions that are being asked to how we can truly help enable the healthcare workforce of the future. I'm Suhail Mirza, and it's vital that at this moment, social care is under the spotlight. Reports are that people are leaving, the workforce is leaving in droves from the sector. The Health Foundation says the situation in social care is desperate. It's never been perhaps more important to hear from people who can help us understand what is going on and some of the challenges and opportunities that may be provided in terms of learning and development. To that end, I'm honoured and delighted to welcome Dr. Jane Townson, the Chief Executive of the Homecare Association, to join us today. Thank you very much, Jane, for joining us as ever.
Thank you, Suhail.
You're always welcome. And also to welcome Mark Story, Head of Learning Innovation at Newcross Healthcare. Welcome, Mark.
Thank you. It's a pleasure.
I'd like to jump straight in, Jane. Skills for Care have pulled no punches, highlighting the scale of vacancies within social care generally. We've also seen the fact that care has been recognised by the current Health Secretary as part of the alphabet ABCD priority. But we're also seeing, according to the Newcross Healthcare Care Survey, where we were conducted by YouGov, that 27% of those surveyed within the care sector were likely to leave in the next 12 months. There really is a crisis, is there not, amongst the workforce in home care?
Definitely, and we're seeing that translate into problems discharging people from hospital. This week, Nuffield Trust reported that 1 in 4 people who are stuck in hospital are waiting for home care. And then at the front end, because people are being neglected in the community, they're deteriorating, ending up in ambulances, in A&E, when with some support at home, we could keep them safe and well in their own homes, So it makes no sense. It's a false economy.
And just to help our listeners, the NHS is well understood and lauded. Social care broadly is now growing, perhaps not equal parity, but getting there. Home care is, I'd like to venture to suggest, less understood as a sector, and yet its scale is vast and its contribution significant. Perhaps you can expand upon that in some of the work that the Homecare Association have done in terms of what the market is and how all-encompassing it is in terms of the healthcare landscape.
Yeah, so overall in social care, there are 1.62 million filled posts, which is higher than the NHS, which comes in at 1.4 million. And of the 1.62 million, 850,000 are home care. And over the last 10 years, the home care workforce has grown by almost 30%, whereas the residential care workforce has remained fairly static. And some of that, well, a lot of it is driven by growing demand. So we've got a population ageing with multiple long-term conditions. And obviously the preference of most people is to stay at home as well and, surrounded by people that they love in familiar surroundings and able to do what they want when they want, eat what they like and have who they want to visit them and so on. So that choice and control piece is really key. We've seen during the pandemic a shift in public awareness of home care and a public preference. So we commissioned YouGov to do a survey in July 2021, and 35% of the public said that they were more likely to choose home care as a result of the pandemic than they would have been before. Most of that was to do with choice and control. I think the sort of restrictions in care homes during the pandemic had quite an impact on people.
No, absolutely. And expanding, we're going to come on to the question of funding, which I think has been described as a national scandal by the House of Lords Economic Affairs Committee 3 years ago. I want to look at the question of pay, if I may. The King's Fund has done a report and analysis showing 10 years ago the pay rate for someone in care was 13 pence per hour higher than someone in retail or sales. 10 years later, it's 21 pence per hour less. This has a profound effect, and I wanted to, if I may ask Mark, Newcross Healthcare, its commitment in terms of supporting people to have a national living wage and being accredited by the National Living Wage Foundation is an important part of its ethos.
Absolutely, and I think Jane will go on to say that it's not enough, and I absolutely agree, but it's part of our commitment or desire to show that a career in social care or healthcare is a viable career option. And when you're in a job where if a supermarket opens up down the road, then you can earn more money and probably have more sociable hours in the work, then that's not a good situation to be in. So as an employer, we're doing what we can, and there is more to do, and it's not just about pay. I think there is a pay element to it, but there are also other benefits that we can offer as a result of being a large employer. And when we come on and talk about career development and enhancing people's ability to develop their careers, then I think that plays into that mix of what we can offer the healthcare and social care staff as well.
No, thank you for sharing that. I think that the numbers are that on average the Newcross healthcare workforce receives pay 16.4% above the national living wage, just for the record. But to expand that beyond pay, that the supermarket effect is well known. Funding, it feels like we've had this conversation over and over and over again. I know there was a white paper and we can't talk about the levy anymore, but the numbers that have been raised. Can we go to the heart of how important that is? Because until we address funding, we're not going to solve the workforce crisis in home care. I don't want to put words in your mouth, but I've heard you say that many times.
Yeah, absolutely. It's pay and terms and conditions. It's not just the headline pay rate, it's also about security of income and the way that work is organised. So many councils still purchase home care by the minute. So that puts such a lot of pressure on the care workers. They feel that they're rushing from one place to the next, and they're in it because they want to make a difference to people's lives and they want to meet people's needs. And it's really stressful when you can't do that. And we're seeing in some areas an increase in the amount of 15-minute visits. Well, you've barely parked and got in the door and, somebody got out of their chair and then you've got to go again. It's just not enough time for the level of need that people have. So that the fundamental issue is the lack of investment, and that investment is not just required to pay the workforce, but also for other elements of investment, such as improving digital innovation and uptake, which it helps the workforce too. So we found that when care workers are given smartphones and they can see their rota on it, and they can also use the other apps to communicate with each other, and because it's a remote workforce, so it's quite hard to communicate and to achieve that sense of belonging, which is also important. But the apps can help with that. But that all requires money too. So it's hopeless trying to go along on a shoestring, and we can see the impact on the NHS. The government's spending less than 4% on it. Less than 4% is spent on home care of the NHS budget, and yet the NHS can't function really unless the surrounding community services are operating smoothly.
And we're seeing it, perhaps that being borne out with the ambulance challenges. I know it's part of the mission of the Homecare Association for the sector to be valued and respected. I guess you're saying until the funding issue's tackled, we just don't have that. I mean,
funding is not the only issue, but it's definitely a key one. If you look at other sectors, so somebody said to me that hotel managers used to be not a very well-paid job, and that changed, and it's been more professionalized. You can do degrees in hotel management, and the esteem of those roles has increased. So I think that's what we need. And there are cultural issues as well. Sometimes we find professionals in other parts of the health and care system not necessarily showing as much respect as they might, because actually the home care workers know the people that they're supporting better than anyone, because they're in there 4 times a day sometimes. So having to justify everything to, say, district nurses or social workers, when actually they probably know better than anyone what's required, is another issue.
No, thanks for sharing that. I wanted to expand looking further ahead. All the projections show that we need the Health and Social Care Committee in July this year put 490,000 more roles in social care over the next decade or so. Part of the survey conducted by YouGov on behalf of Newcross Healthcare found that 60% of the respondents were asked to do tasks for which they had no qualifications. So I wanted, Mark, if I could come to you first in your role to expand upon what Newcross is doing, because part of its mission is to be the learning partner for life within the sector. And that's a startling finding from that survey.
It is. And we find with our staff that there is a huge appetite for learning. And what that represents to me, much what to echo what Jane said, particularly in the areas of the business where people are looking after, our staff are looking after people in their own homes. There is a real appetite to understand those care needs at quite some depth, and perhaps beyond the price point of that member of staff. So we find that there's a huge appetite for learning, and part of the Learning Partner for Life initiative is that our vision, the world that we want to create in this spin-off offering called Future You, is universal access to free healthcare education. And that's right from entry level, so create more people coming into the sector, but the people that are already in the sector, provide them career opportunities to advance their lot within the sector right up to degree level. And if we can achieve that vision, if we can enable healthcare professionals to achieve their potential, then I think we'll be playing into what is already a healthy appetite for that kind of learning and career development within the sector, but isn't present everywhere.
To allow you to expand upon that, Jane, some of you, obviously your members are faced with the constraints that they have, but there's been some great work which you've highlighted in some of your research in terms of career development and offering a skills pathway for people within home care.
Yeah, I think Mark's right that the skills required, they're many and varied. And during the pandemic, we saw more tasks being delegated to home care workers because other professionals like GPs, district nurses, social workers were told to remain at home as much as possible. And unfortunately, in some cases, those expectations were placed without the training. So having access to training is very welcome. I feel excited by the opportunities for building on that. The technologies for remote health monitoring, we're seeing the NHS focus more on hospital at home, services that they're calling anticipatory care, but that's the idea of identifying people with complex needs and focusing on preventative work with them. And yesterday I was also at a meeting when NHS colleagues were talking about sort of nationally commissioning intermediate care in a structured way, which it has been done before, but kind of piecemeal. Mm-hmm. So I think the whole mood music is, can we shift to a more community focus? And that's very welcome. But there are more sort of challenges about accessing training with a remote workforce and with people that are very busy. And the shorter you are of labour, the harder it is to find time to do the training. So, we've noticed that there's been an increase in appetite for online forms of learning as well, because you can be very flexible about that. But there, the kind of things that some of our members are doing, for example, when you've got the data that comes from digital, you can see what's going on more clearly. So they noticed with their particular client group that people were ending up in hospital with urinary tract infections that hadn't been diagnosed early enough. And what would happen before was that the doctors would sort of say, or the care worker would phone up and say, Betty's a bit off colour. And the GP would say, well, just leave her for a few days, she might pick up. Mm. But what the provider did was train their staff in doing some simple physiological observations, temperature, and doing urine dip tests. So they're not diagnosing, but when they phone the GP, they say, Betty's off colour, I've done a urine dip test, this was the result, I've done the temperature, this was the result. And they found that the GPs then were much more willing to prescribe straight away. And they reduced unplanned admissions to hospital by 63% just from doing that, which is really simple. So if you imagine scaling that kind of approach, and all kinds of other areas, dementia, diabetes, care, nobody in care is trying to diagnose or do anything clinical, but they can work under the direction. And what we'd really like to see, I think, are more multidisciplinary teams on the ground, because in practice, that's what happens. That the care workers talking to the district nurses, the social workers, the hospital staff. It's all a little bit ad hoc. If everybody felt that they were part of a team, and I like the anticipatory care idea because of that, and then we can organise the training to support that as a team, that would start to make quite a big difference, because then you start to get that mutual respect as well.
No, absolutely. And that's sort of a vision which is, of course, I guess, enshrined in the spirit of the statutory changes that came into effect in July with the integrated care systems, where social care, voluntary sector, the NHS is supposed to work together. Just touching on the technology piece, Mark, as a tool for development and training. It's something I know it's very important to you, but even more fundamentally, the YouGov survey commissioned by Newcross Healthcare found that having flexibility was vital in terms of retention. So both those issues, how important is, I think there's the Health Force app has allowed Newcross Healthcare workers to have that flexibility, but also a platform to access the training that Jane's talking about.
So the Health Force Go app does provide that flexibility, and there's access to all of the training, all of the learning within the app. So there is the ability to learn, and we find that our staff will finish a shift at 1:00 and they'll go on and do learning at 1:00, 2:00 in the morning. So it's literally a 24-hour business. And every 100 seconds, somebody is completing one of those courses around the clock. But because we are focused on using technology to support and scale our healthcare offer, it gives us an advantage that we can start exploring how we use technology in learning. Training traditionally has been quite a resource-intensive activity for a resource-limited sector. And when we've spoken to nurses or carers and talked about their learning experience, they've said that when they've gone in to shadow or they've gone in to do some sort of supported training, that often staff changes or staff shortages will limit their experience at doing that. So we're looking at how we can exploit technology to provide not just some sort of level of training, but actually an enhanced level of simulation and assessment. So we've got a project at the moment to see whether we can use mobile phones to assess people's physical movement. And the end game there is that we might find ourselves in a position where we can assess people and sign people off as competent at scale remotely while they're carrying out their activity. So we've got a ways to go yet, but I think we can support the sector by taking some of that resource burden off the training agenda.
No, absolutely, and I think we are. There is an imperative to expand the workforce. And before I segue into other things, I just wanted Jane to touch base on less technologically enshrined, but vitally important, I believe, is the continued role of apprenticeships within expanding the workforce and what your members are doing with that.
Yes, in home care there are more challenges because you've got lone working, and especially for young apprentices, the driving piece can be quite a problem, mainly because the insurance for vehicles when you're young is quite high. But and also for a while the apprenticeship rules were not very helpful with the sort of 20% time off the job that you had to have, which nobody could really afford. But there's more flexibility now in how that's delivered. So I think we need to do more though to encourage young people in particular. You can be any age to do an apprenticeship, but for the young people, I'm quite struck by the success that New Zealand has had in attracting young people into their workforce, and that's because they deliberately set out to create a career structure, and they put almost like different national living wages for different levels of skill and competence, and also recognised experience. In our situation here, the funding is so limited that we're struggling to do that. So, the government talks about career pathways, which is lovely, but actually, if they only give enough money that, if you're lucky, everybody's on national living wage, regardless of whether you walked in the door yesterday or you've been there 10 years, you're not really going to encourage people to go for promotion and do more qualifications. So the pay is really quite critical to underpin it. But Mark's right, it's not the only factor, but without it, we are going to sort of struggle to create that sense of development and the incentives. In my previous role, sometimes staff would say to me, well, Jane, why should I bother and go and doing a qualification? Because I'm not going to get paid, I might get paid 8p an hour more or something. I might as well do more shifts at this level. And we just, that wasn't what I wanted to do, but that was all the funding that we had, because we did a lot of state-funded work. We've got to somehow break out of that. And certainly in the private pay part of the market, there is more scope because the income is higher and more can be invested in the staff.
And people need to be aware, of course, that the staff in home care, social care are potentially competing with NHS roles, which offer a wider range of benefits. In terms of just touching upon the expansion of the home care and the social care workforce, the YouGov survey that Newcross Healthcare Commission found that people do want to have careers within the sector, but astonishingly, 67% of those that were surveyed who were interested didn't know how to enter the sector. So I guess there's an opportunity of advocacy and having ease of access technologically for people to be able to understand how you go about doing that.
Absolutely. And we've seen during the pandemic that there's been a lot of other sectors that have closed down, and we've seen new people coming into care. So they may be estate agents, or who else have we spoken to? Human rights lawyers. A whole range of different people have come into the care sector. And Jane mentioned that there is a huge sense of fulfillment and satisfaction that they get from doing that. But they say, actually, I'd love to continue this, but I've got a family to feed. I've got, if we can demonstrate to them these career pathways so nursing degree, for example, if your aspiration is to have a career and you can find a pathway that will take you through to a nursing qualification for free, then I think people that we've spoken to would be very attracted by that. The prospect of going into debt to get a nursing degree and then move into a job that is relatively low paid compared to other degrees that you might get and other professions that you might get into, and having to pay all of that tuition fee back and so on is an absolute travesty, really. So yeah, I think that the prospect of offering nursing degrees for free and all of the career opportunities leading up to that and perhaps beyond is what we can provide into the mix.
I think it will be a profound step change. We've talked about pay again, we've talked about funding. I'd like to come back to that, if I may, not restricted to that, but the social services directors are on record as showing demand is inexorable, it's rising. We have the challenge of the cost of living crisis, which we can't ignore. I wanted to touch upon your campaign for a minimum price for home care, because it is commissioned, it is paid for by local authorities, over £2 billion in England alone. How important is that we have an understanding that there is a minimum price and it's not plucked out of the air? There's a lot of science around this, which comes back and informs the pay rates.
Yeah, it's absolutely vital. And we're actually quite pleased that as part of the government's charging reforms, they have told local authorities that they have to conduct cost of care exercises, which we've been calling for years. They are currently analysing the data. 5 trailblazers have already reported. completely as expected from our perspective. You know, these numbers seem to be coming out at 20 to 30% higher than the fee rates that they're actually paying. And we've said for years that it in our view, it should be unlawful for public sector commissioners to purchase care services for lower fees than it's possible to ensure compliance with regulations, both employment regulations and care regulations, but particularly employment, because it's national minimum wage. You know, that is the issue there. So I think it's positive that the government is doing this. The next thing we've got to try and do is extract more money from them. Because at the moment we think that they've probably allocated about a tenth of what is actually needed.
That's a big job that you've been involved in for many years. And to really finish off, I just want to paint a broader picture. We are at a stage of profound change. The move, which goes back 10 years, policy initiatives, if not longer, community-based care, joined-up ecosystems. Are you hopeful that home care will finally be able to have the recognition it deserves? And what are the opportunities you see in terms of new roles? Because, as you say, care delivery is changing, treatment is being revolutionised, and home care workers must, by definition, play a vital role in its delivery over the next few years.
I feel optimistic in that in the white paper, People at the Heart of Care, there was a very strong element of that vision that was about keeping people well at home. I think everybody sees the sense of doing that. At the moment, the rhetoric and the funding don't quite match, but I think we're marching inexorably to that point. I mean, I should say that care homes will always be needed. They have a place. You know, not everybody can be looked after at home. And I think one thing which is quite important is that there are many different types of roles in care organisations, and in the larger ones, you know, all the kinds of roles that are in any business. So I can think of care workers who started doing care, but they've moved into HR, or they've moved into finance, or they've moved into IT. Some of them become CEOs, and others, you know, you can do the sort of nursing line that Mark said through qualifications, sort of level 3, level 5, then the degree. Technology, you know, we created some roles called care technologists in my previous organisation, and we're going to see more of that because more people at home have got monitors and, you know, remote consultations. We saw that developing during the pandemic, but just because of sheer lack of people, we're going to have to do more of that, I believe. But I think the way that the health and care system operates at the moment needs to change to accommodate that. So, for example, if you have a loved one at home with monitors in their house and you discover that they've fallen, knowing that is only useful to you if somebody can go and pick them up.
Absolutely.
And at the moment, those responsive services are not universal and they're not accessible by everybody. So we need to, and the GPs are very overworked. So if we monitor everybody's blood pressure, let's say, and we go to the GP and say, we've noticed that there's been a change in Betty's blood pressure. At the moment, they'll probably say, oh, please don't tell me about Betty's blood pressure. I haven't got any time to worry about it. So we need to think of some other ways of handling those kind of, you know, the data that comes from it. But I feel quite excited because I think, you know, data is the key, that there's some very clever sort of data science that can be done with very simple observations. There was a paper that was published by a French group that sort of showed that you could predict with 70% accuracy admission to A&E 2 weeks before it happened, just on the basis of observations that home care workers made. So if you imagine scaling that, training them to be able to do those observations and to do that record keeping and to give them that professional support, I think will make a huge difference.
Well, scaling that alone might help the NHS get its efficiencies targeted in one go. One final word from you, Mark, just listening to that, the expansion of technology roles as part of a broader mission. I know that Newcross have to democratise advances in treatment and care at home. Just you're obviously going to be, you've got quite a big target there to expand the level of training that you've got right across the board.
Yes, universal access to free healthcare education to everyone is quite a big ambition, and we're right on the start of that. But we're We're encouraged by the appetite that we've seen over the last 4 or 5 years with the access to learning from our healthcare staff and social care staff within Newcross. And we don't see that the rest of the sector will be any different, that there will continue to be that appetite for learning. So while it may be society needs to catch up in terms of the value that it places on healthcare and social care as a career, I think people within those sectors do value what they do, and they take it seriously. And one of the obligations of taking it seriously is to upskill yourself and develop your understanding of what it is that you're doing. So, yeah, I'm encouraged by the culture and attitude of the people within the sector. But I think the debate is how the rest of society supports that, encourages that, enables that.
No, absolutely. I think for me, that idea of providing universal access free for training and opportunities is profound. I think the hope that Jane has shared in terms of the future for home care and its place in this new ecosystem is inspiring. We do need to get the funding and the pay rates, and the advocacy for the home care sector must continue ceaselessly. On that note, I know we could spend hours on these subjects, but I think it's the right place there to close for today. So I'd like to thank you, Mark, for your time and your enlightening views about what's training and development opportunities. And Jane, as ever, thank you for your candour and your wisdom.
Thank you very much.
You're welcome. If you've enjoyed this episode of Voices of Care, please like, subscribe or follow us from wherever you receive your podcasts. And if you really want to learn more information about how we're enabling the workforce of the future, please visit us at newcrosshealthcare.com/voices of care. In the meantime, I'm Suhail Mirza. Goodbye and thank you.